So, I'm going to go over the oxygen device equipment up through the reservoir, so all the low flows in the reservoir, and then I'm going to talk about the first air entrainment so that when you come to lab next week, you are ready. And then I'm going to post a video later on the air entrainment, the first air entrainment I'm going to talk about. It'll be later this week though. So, all right. Review. Airflow meter. I remember in class I was telling you about the quick connects. This is the quick connects we have. So you push this into the wall and this latches on to a device and the compressed air goes through this orifice. And then there's when it's attached, there's a button up here that you push and it pops out. This is oxygen without a quick connect. It's got the universal DIS system that you're going to scroll into the wall. Okay, not scroll, screw. All right, so review your resuscitator mask. It's going to be tear-shaped. It's going to go over your face like this, not pushing on the bridge, but in the middle area. And we will practice bagging with this later next week. But I did want to show you the C&E because it's important that you know how to bag. So I don't have an actual person, I have a monkey. And you're going to be at the head of the bed. You're going to make a C like this. Turn my hand around so that it fits. All right. So you make a C with this part, and the E goes under the chin and pulls the face up into the mask. Maybe I'll get my husband to do it later. We'll see. I might post a video of that. But you're going to pull up with the E. You're pulling under the jaw and up into the mask. And with your C&E, you're applying equal pressure down. And that's the resuscitator mask. And it attaches to the positive pressure ventilation bag or ambu bag or resuscitator bag. Just depends on where you're at on what they call it. They're all resuscitator bags. They are all positive pressure bag mask ventilation, and ambu is a brand name, but that's just like Band-Aid is a brand name. Technically it's a bandage. So if you go to Kroger and you want to buy the Kroger brand you're going to buy bandages like Band-Aid. Jello is a trademark name. It's gelatin. Here's some other ones. Q-tips. Q-tip is a trademark name. They're actual cotton tipped swabs. So ambu is a brand name of a resuscitator bag. So ambu bag hooked up to oxygen. Got the oxygen tubing. Make sure it's attached to the oxygen. And you will turn this up to between 15 liters and flush, which just means you just turn it all the way up to the balls, all the way up to the top. You need to check your flow meters though and make sure that the liter flow goes up to 15, because there are some flow meters that only go to 10 and some that only go to 5, some that are partial liters for kids and stuff. So double check that even though you're flush, you may not be at high enough liter flow. You're going to attach your mask. I don't know where my elbow went. I'm going to attach your mask and bag. All right. Just a review of that. Put that down. Those over there so I can reach. Sorry, it's a hot mess up in here. But I'm ready. I even have stuff for next week if we need it. We're not going to need it, but I have it if we need it. Ow. And I literally just knocked that down. Welcome to my life. Okay. Oxygen devices. Again, page 912 and 913. You need to know these numbers, and I'm going to talk about them as I show you the devices. So If you're like, where the hell is she getting these numbers from? They're from the book. All right. So the first, if you've watched the other video, this makes more sense. So I highly recommend you go watch the PowerPoint video for class before you get into the lab part. I'm going to go straight into the reservoir cannula one because I just want to put it up and not have to come back to it. It looks like a mustache. You can see where oxygen comes in here, fills this area up, and overflow comes out these holes here, so it doesn't blow up like a balloon. This part goes in the nares, right there. So you're going to put it here. I cleaned it. You're going to put it here, and then you wrap it around the patient's ears, and then you tighten it like a bolo. If you don't know what a bolo is, look it up. All right. Then they breathe in and out, and they get a higher FiO2 because of the reserve part. Okay, so that's reserve cannula, and then there's also the pendant that kind of looks like these. It goes across here, but it hangs here. It has a pendant, a big flat circular area that holds reserve oxygen, just like the mustache does. All right, so put that one up. Okay, nasal cannula. Okay, well, nope. The reserve cannula, we're going to go from 1/4 to 4 liters per minute. It could go higher than 4 liters per minute, but you can't add humidification to that effectively. So you don't want to go over 4 because that's where you have to add humidification. And it gives 22 to 35%. This is a standard nasal cannula. You slide this part down. When you first take it out, it's pretty much up high tight. There are 2 ways that you'll see nasal cannulas put on. One is technically the right way, and one is sometimes more comfortable for patients. So first you got to find the nares. Ta-da! So the catheter part that goes in the nares kind of rounds toward it. This part goes on the lip. So you want the tips of the cannula that are curved to curve with the nose. So your nose goes back like this. Your nose is full of these little conchs, like divots, and those divots cause, when you breathe in, the air becomes turbulent and it spins. It gives it more time in the sinus area, and as it spins around, it picks up moisture and it picks up heat. And so the air you're breathing becomes moist heat air. And then you breathe in and into the lungs. So anytime you're putting a flow higher than 4, you have to add heat and moisture to the air that you're supplying supplementally. And that's because your nasal airway cannot heat and moisturize faster than 4 liters per minute. And then we get into devices we're not going to talk about today, but there are devices where we completely bypass this. Our nose, which is our heater and moisturizer. And when we bypass those, we have to add an actual, there are 2 different types of heat and moisture you can add. 1. 2, when you breathe in, you're getting 21% all the way down into your lungs. And then you exhale, the first third that you exhale is called dead space because it happened from here to here, right where the pharynx, larynx, right to the epiglottis. And that dead space area, gas exchange did not take place in. So this last third is room air and nitrogen. So it's room air, so it's 21% oxygen and 79% nitrogen in this area. So when you go to exhale, the first third you exhale is just ambient air, and then the next third that you exhale is area where dead space and gas exchange did not take place. It's from the trachea through the bronchioles, bronchioles, till the 4th generation or deviation, and that's where gas exchange starts to take place. And that last third that you exhale gas exchange is taking place. So that's the gas that's not going to be not going to have, or not going to have, it has had gas exchange, so the oxygen level's lower and the CO2 levels are high. So when you first exhale, you exhale this part and then this part, which is 2/3 to a half of the volume you're exhaling. No gas exchange is taking place. So then that last part of your breath has low oxygen and high CO2, and that is, as you exhale that, if you measured it, it's low